babies are great and we love babies, but babies will cry sometimes, even if you're doing all the right things. So you might try to change them, feed them, swaddle them, soothe them, rock them, everything, the whole 9 yards. And sometimes they will still cry and you might not know the reason. Hey guys, welcome back to my channel. My name is Paulina and I'm currently a third-year medical resident practicing in general medicine. In today's video, we're going to be talking about things you should know when you take a new baby home from the hospital. First, let's get started with talking about eating. So in the first 24 to 48 hours of life, it's really important that you keep a close eye on how well your baby is eating. Your baby should eat at least every 4 hours, and if they're not eating every 4 hours and sleeping through, you should be waking them up to eat. So this can kind of vary, so it will total between 8 to 12 feeds per day. And then if your baby is not breast milk fed and they're being formula fed, the baby will take anywhere between 1 to 2 ounces typically. But again, you'll start with small volumes and work your way up to that. If you are breastfeeding and this is your first time breastfeeding, sometimes it can be difficult to assess how much the baby is actually getting. So there's different ways to kind of tell. But the main thing to know is that your baby will be making enough wet diapers for that day of life. So typically we say by 5 days of life, they should make at least 5 wet diapers. So if you are breastfeeding, it's important to know that at 2 weeks of life, you should be starting to supplement your baby with vitamin D drops. This will typically be given to you when you get discharged from the hospital. But basically, we want to replace vitamin D because breast milk is actually deficient in vitamin D and it's important for growth. So even if your baby is being formula fed, they will not get the recommended amount of vitamin D until they are able to drink at least 32 ounces of formula per day. So this is still recommended for babies who are formula fed. The next thing to talk about is sleeping. So your baby should be sleeping on his or her back in a crib by themselves with no extra pillows or blankets. If you feel like your baby might be cold, you can always opt to do an extra layer of clothing or to do a swaddle. But just make sure that if you're going to swaddle them, that you don't use thick or heavy blankets because those can come undone very easily and easily obstruct baby's breathing. So definitely want to make sure that we're clearing the bed for the baby. And also remember that we're doing all of this because we want to prevent sudden infant death syndrome, where it could definitely be detrimental and you could potentially lose your baby because they can't breathe. Another thing to know about sudden infant death syndrome is that we want to prevent it by avoiding smoking around the baby and even in the car where the baby will travel. The next topic is a little dirty, so we're going to talk about pee and poop. So I kind of already mentioned that babies should be making wet diapers that correlate to their day of life. So on the first day of life, we want 1 wet diaper. Second day of life, we want 2 wet diapers, up to the 5th day of life. And then every day after that, your baby should be making 5 wet diapers, okay? So that tells us that they're getting enough that they need and they're not getting dehydrated. When it comes to stool, so you'll notice initially when your baby is born, they'll have like a very thick and sticky and black stool. That's very normal. Some parents can kind of freak out, but it's very normal and it's called meconium stool. This is baby's first poop. And as your baby continues to eat and have other bowel movements, it's going to transition. So we call that that transitional stool is more of a green color. And then later on, after the first week of life, you'll notice that they'll actually transition to yellow or mustard stool. And then the last thing that I wanted to mention was sometimes that you'll notice little red specks in your baby's diaper. That's not actually blood. Sometimes when baby is having the first urine of their life, they actually release little crystals from their kidneys, and it can appear like it's blood. The next topic that we're going to cover is fever. So, okay, guys, really listen up to this part. A fever is, in a baby, a medical emergency. So we define a fever anything above 38 degrees Celsius or 100.4 degrees Fahrenheit. And the reason why I mention this is because a baby who is just born is very susceptible to serious infections because they haven't gotten their full shots yet. So any baby under the age of 2 months that has a fever needs to be brought into the emergency room immediately. You do not want to stop and go by your pediatrician's office. You definitely just want to take the baby to the nearest emergency room possible because it can be a life-saving thing. Next, we'll talk about normal baby breathing. Okay, so you may notice that your baby may have kind of a funny way of breathing initially. So they'll do this thing where they're kind of panting fast and they'll do something like kind of like a dog, and then actually they might actually stop breathing altogether after they do that. So it might look something like this. And then just stop breathing. So this can be really concerning for some parents if they haven't experienced it before. But I'm here to tell you that it's mostly normal finding in a baby that's that small. And the reason for that is because they're still trying to figure out what is normal breathing. Their brain is still kind of connecting with their respiratory system, so they still haven't gotten the full hang of it. One way to tell if baby is not breathing normally is if they're having longer pauses where they're not taking a breath at all. So if they're doing the panting thing and then they stop, you want to count to see how long they're holding their breath. If they're going past 15 seconds, then that would be concerning and you should definitely get that checked out. But if they're resuming their breathing without any signs that they're working hard to breathe, such as flaring their nostrils or sucking in their chest or using their muscles to really take in deep breaths, then there's nothing else to worry about. This is really normal. A lot of parents tend to get scared when they first see it, but like I said, it can be very normal because it's what we call like neonatal periodic breathing. Next, we'll talk about bathing and general hygiene. So with babies, obviously they're going to have blowouts in their diapers and they're going to be getting things on them. So we want to keep them clean, which is fine, but we also want to make sure that we're keeping the cord dry. So if you're going to wash off your baby, make sure that you're not putting them in a submerged bath and that you're opting to do just a sponge bath until the cord falls off. This should be by the first week of life. You don't have to do anything extra for the cord, just keep it dry and keep it clean, like I said. If you have a baby girl, you may notice that they might have like a little bit of thick or like mucousy discharge from their vaginal area. This is normal. This is just them withdrawing from the mother's hormones. And also you might notice a little bit of bleeding, which again can be normal in the first week of life for little girls. So the best thing to do is just to wipe it. Don't try to be abrasive or anything. As long as it looks clean, you don't have to do anything extra because it's going to resolve on its own. And then if you have a baby boy, say you haven't chosen to circumcise them, you don't want to be retracting the foreskin at this point. There's kind of a little bit of misinformation with parents sometimes that they have to be retracting the foreskin, but babies have adhesions around the penis and this can be really painful for them. So you want to just wait until the foreskin retracts on their own. This will happen with normal nighttime erections for baby boys. So this will happen naturally as they grow. If you have a baby who is circumcised, you want to make sure that you're keeping up with the circumcision. So definitely continuing to put on some Vaseline, making sure that it's nice and clean for the first week or so would be the best thing to do. And then you'll notice after about a week that they'll kind of form like a yellow scab looking thing. And that is also normal. It's just basically the tissue trying to heal itself, and you should just leave it alone. It's going to heal on its own. The next thing we will cover is jaundice. So jaundice is basically when a baby's skin gets yellow, and this is due to high bilirubin levels in the blood. So like I said, this is something that happens very commonly in babies and it can be totally benign, but your doctor will let you know if your baby's bilirubin level is high. So in the nursery, what we do is we shine a special light on the skin and it tells us an approximation of that bilirubin level in the blood. And then based on the risk factors for your baby, we'll determine whether that level is dangerous or not. The main reason why we worry about this is because it can cause a condition called kernicterus, which can affect the baby's brain and do permanent damage. So if you take your baby home and you realize, hey, the whites of their eyes are looking more yellow, they're also looking a little bit more yellow too, then that would be a reason to take your baby to the doctor as soon as possible to get them checked. Be sure to check out my video I made all about jaundice because that in of itself is a whole other topic. Next, we will cover baby safety. So baby safety is extremely, extremely important. Remember that when you're taking a baby home, you're basically going to need to respond to all their needs, but it's important to keep a few things in mind. So first thing I kind of talk about is car seat safety. So it will be required for you to have a car seat for you taking baby home. This will be a rear-facing car seat, and they should remain in this car seat until they're at least 24 months of age or even older if they haven't outgrown it. So that's really important. And then I already talked a little bit about smoking around babies. So if they're traveling in a car, definitely make sure that no one is smoking in that car. The next thing that I talk about is making sure that you've checked your smoke detectors at home. And then the other thing that I already kind of alluded to was sudden infant death syndrome. And then the last thing I want to cover that I feel like is not very well emphasized sometimes is shaken baby syndrome. You never want to shake a baby. Shaking a baby can cause brain damage or even death. So babies are great and we love babies, but babies will cry sometimes, even if you're doing all the right things. So you might try to change them, feed them, swaddle them, soothe them, rock them, everything, the whole 9 yards. And sometimes they will still cry and you might not know the reason. So I suggest that in that situation, you're a better parent by just putting your baby down in its crib, a place where they're going to be safe, and you walking away from the situation. This prevents you from getting agitated or doing something that you might regret later. So when this happens, it's better to call for help, call a partner, call family, or call your pediatrician and talk things out with them and say, you know, they continue to keep crying, should I be concerned? But basically, the main thing that I want you to take away from this is that you need to compose yourself and be able to kind of get yourself back together so that you can go back and assess your baby's needs. So with all of that being said, if you have a new baby, congratulations. Babies are awesome. They're a lot of fun to take care of. And your baby is going to be very different from other babies. So with time, you'll get to know what their needs are and how you can address them. Again, if your baby is acting different or doing something new that you are not familiar with and you're concerned, you always want to be consulting with your pediatrician. Please let me know what are some of your questions about taking care of a newborn, and I'll be sure to answer or make a video about things that you guys are wondering about. Like, share, and subscribe to my channel, and let me know what other things you want me to discuss so that we can all help to take care of babies together. And as always, friends, be good, be safe, and be healthy. Bye now.